This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And good morning, and thanks so much for joining us today on Columbus Concerns. Ohioans have now been living with COVID-19 for 6 months, and a lot has changed in those 6 months. Governor DeWine gives a 6-month update on the fight against COVID-19. He also takes a look at what Ohio colleges and universities are doing over this Labor Day weekend to try to keep kids safe. So again, 6 months with COVID-19. Here's Governor DeWine.
Today is the 6-month anniversary of the decision to cancel spectators attending the Arnold Classic. 6 months, hard to believe. That was certainly a tough decision for us, but I believe it set Ohio on a very good path. I want to thank Columbus Mayor Andy Ginther, Columbus Health Director Mashika Roberts, and of course then Ohio Director of Health, Dr. Amy Acton, for their work on that decision. It was the right decision. It was a tough decision, but it got us started. It's hard to believe that we've been at this now for 6 months. We've all learned a lot in that period of time, learned a lot more about this virus. Ohioans from the beginning have stepped up. You have stepped up. And although we have had great tragedy, number of Ohioans dying, number of Ohioans getting very sick, number of Ohioans who have lost their jobs. The fact still remains that Ohioans have done pretty well throughout this in the sense of stepping up and doing what it took so that we did not get in a situation like some other states, at least not so far, where we saw the virus spike up dramatically. We have been able to avoid that, and frankly, that's a tribute to what each and every one of you has done during that period of time. Labor Day is coming up, Labor Day weekend, and the White House has talked a lot about this. And people may ask, well, what's so important about Labor Day? What we saw over the 4th of July was a rather dramatic uptick in travel, people getting together, what we would expect people in a normal year to do for the 4th of July weekend. And as a result of that, in some days, weeks after that, we began seeing the uptick again in number of cases. So Labor Day is coming. The White House has been very clear about the dangers that we face on this Labor Day weekend. Vice President Pence expressed it directly to me and asked me to share with all of you the message of please, please be careful. What we do this weekend will really determine what our fall is going to look like. And we've got a lot at stake. We've got kids back in school. We've got college kids back in school. We've got a lot of things going for us in Ohio, and we do not want to turn back. What we do, what we don't do, will certainly determine the fall. We certainly can still have fun. We can get together with family members. Many people will be traveling. The medical experts tell us that it's really not so much where you go, but rather what you do and how you do it. For example, if you drive an hour to a state park with your family, you're together, you go out and you hike, you enjoy the great outdoors. That's one thing. And that's pretty benign, that's pretty safe. But if you just walk next door to your neighbors who's having a barbecue with a lot of your friends and neighbors there, but no one social distances, no one wears a mask, even though that's right next door, it may seem like it's safe. It's a lot more dangerous than going to that state park, even though you drove an hour. So it's not just about, how far you go. It's really about what you do, what we all do when we get there. I want to show a chart. One of the things that we have seen, we're going to hear in a moment from Miami University's president, and a lot on the news, of course, national news as well as local news about our universities coming back in. This chart shows the weekly data from March through the end of August, and it features age groups among Ohioans age 0 to 29. And so this is, the truly remarkable numbers. And again, universities are back. A lot of our universities are doing, frankly, a very good job in testing. And because of that, you're seeing that 35% of the cases this past week, 35% of the cases of those tested positive were in that very fine age group of 18 to 22. So just an interesting chart as we move forward. And to our friends in college, again, we ask you to be careful because while all of us when we were your age thought we were invincible, you can pass this on. You can get it and pass it on, and that really is the danger that's passed on to someone who is older, someone who has a medical problem. And we have seen where those 18 to 22 have, in fact, certainly have gotten sick. We know that your odds, mortality is much better odds, obviously, the younger you are. So while many of these college students certainly may not get seriously sick, what we are concerned about is the spread. And we'll talk a little bit more about that with Miami's president. Eric, let's go to the kind of the key indicators today. We're at 1,345 cases and 50 deaths. So certainly not good. It's consistent with what we've seen. We've sort of hit a plateau, and we certainly can't drop below 1,000, and we're around the 1,300. That continues on. The sad note, of course, 50 deaths reported to the Department of Health since yesterday. It's the highest number of deaths reported to the Department of Health on a single day since June. We're also reporting 89 new hospitalizations and 14 new ICU admissions. Eric, let's go to our top 88 counties. As you recall, we have started doing this a few weeks ago, really just trying to do the snapshot of 2 weeks to see how many cases each county had, and then we equalize that out by putting it per 100,000 population. So you'll see those counties. Let's go, Eric, to the 10, if we could. And you'll see Putnam County and then Montgomery County, Meigs County, Butler County, Jackson, Darke, Shelby, Mercer, Henry, and Auglaize. And again, most of these counties, 9 of these 10 counties are fairly rural counties. Butler is certainly not a rural county. At least most of it is not. But so that really leaves 8 that are pretty much rural counties. Let me kind of go through these for a moment. So let's go to the map now. So this is the new map. 67 of our counties stay at the same level as they did last week. The greatest movement happened with 12 counties moving down from orange to yellow. We'd like to see that. We now have 39 yellow counties, the highest number we've had since July 2nd. The population of Ohioans living in counties, yellow counties also hit a high. To date, 26%, a fourth of all Ohioans, are now living in a yellow county. So that's improvement. Lorain County dropped 2 levels this week from red to yellow. And frankly, we asked what was going on in Lorain. Local health department officials tell us that more residents are following the protocols or wearing their masks. Residents also are using caution when planning gatherings, are taking the health department's recommended protocols into consideration when making those plans. Certainly great news, but we still have counties that are red. 7 counties this week: Butler, Lucas, Mercer, Montgomery, Preble, Putnam, and Wayne. Let's start with Putnam County, which, as we said, has the highest rate, 268 cases per 100,000. So they are at number 1. They're red for the first time this week. They've seen a sustained increase in new cases. During the past 2 weeks, they've had 91 new cases out of a total of 358 cases during the entire pandemic. That's a quarter of all the cases they've had just in the last 2 weeks. They've increased from an average of 3.6 cases per day on August 15th to an average of 9.3 cases per day on August 26th. The county has also seen a sustained increase in emergency department visits for COVID-like illnesses, which, of course, are the early warning signs. The cases they're seeing are primarily associated with family gatherings and community spread. Let's go to Montgomery County. They remain red this week. They've had 19.3% of their cases during the past 2 weeks. That's 1,191 new cases in 2 weeks compared to 6,146 total cases since the beginning of the pandemic. They're seeing a sustained increase in outpatient visits for COVID-like illness from an average of 36 visits per day on August 24th, now to 46.3 visits per day. Now let me turn to President Crawford, president of Fran's alma mater and my alma mater, Miami University. Miami has been aggressive in what it's been doing, and Dr. Crawford. So Dr. Crawford, thanks for joining us from Oxford. And, I know you've been aggressive in regard to testing, and kind of tell us where you are. You had kind of a different timetable in regard to starting on, I think you started all online. Is that correct?
That's correct, sir.
And so just kind of walk us through what has been your experience in regard to the COVID virus and how you prepared for it, and what you're seeing right now and where you are.
Sure. Well, thank you so much, Governor DeWine. It's great to be with you today. And thank you so much for your leadership and keeping Ohioans safe and healthy. We're deeply grateful for all that you do for all of us. And we are sending our best wishes from Oxford to our First Lady, Fran. But let me start off by saying a few things about our gratitude and what we're doing in collaborating with Chancellor Randy Gardner of the Ohio Department of Higher Ed, and with the presidents of our state institutions, with the Inter-University Council of Ohio and its president, Bruce Johnson. Through our collaborative efforts with our public university colleagues, a return to campus plan was created with broad input across all the universities that included 24 categories with baseline health protocols. These protocols included some most recent science information and practices, and at Miami, we incorporated all these into our Healthy Together plan for our reopening strategy. We work collaboratively and frequently with our health commissioner, Jenny Baylor, and her dedicated staff at the Butler County General Health District, our partners at TriHealth, and the city of Oxford to implement our institutional plan and to help protect our university community and the residents of Northwest Butler County. Well, we began this semester with the vast majority of our undergraduate students being taught remotely. Our first and second year students are not scheduled to begin moving in to the residence halls until September 14th. And then in-person classes and hybrid classes will begin on September 21st. That being said, we currently have a significant number of students living off campus in the Oxford community. And even though our first and second year students have not returned to campus yet, we have seen a spike in COVID cases among our students living off campus. We now report 704 positive COVID cases, and we are thankful there's no hospitalizations. But in the short time frame, this surge of cases really demonstrates the aggressive nature of this virus. And in response to this spike, and working together with all of our partners, we have increased our testing strategies and have taken other actions. Testing broadly is so important here. In partnership with our TriHealth health provider, we have the capacity to test now over 3,000 individuals each week through wide net and surveillance testing. This is in addition to diagnostic testing of persons who are presenting symptoms. These two approaches help identify asymptomatic individuals who are positive or potential clusters of positive cases. The wide net strategy allows us to test individuals who have been potentially exposed to the virus, but perhaps not have been identified as a close contact through the tracing processes. And on the surveillance side, testing identifies a sample of individuals for testing, even though they are not symptomatic or identified as having close contact with a positive individual. So we are also investing in a technology that can provide test results within 15 to 20 minutes. And once operational, it'll further enhance and advance our testing strategies here in Oxford. And in addition to all this testing that we're doing, we are also aggressively applying other strategies to flatten the curve and reverse our trend. First, we are grateful to Butler County Health District for aggregating all of our tests from all testing sites. So not just our healthcare partners, but also to have a more complete count of positive cases across all of our students. That's very important. Second, Butler County Health District has also hired many more contact tracers. Miami provided 80 of those, 15 more came from the Ohio Department of Health, and more are being trained. And contact tracers really enable us to more quickly quarantine and isolate students to help slow the spread of the virus. And then in conjunction with advice of the Butler County Health Commissioner, we are emphasizing the importance of staying home this Labor Day weekend. And as you have pointed out, Governor, hunkering down this weekend will greatly minimize the potential for further spread of the virus. We continue to educate our community on the importance of wearing face coverings, maintaining physical distancing, practicing good hand hygiene, and limiting gatherings to 10 or fewer people. And our city of Oxford has passed aggressive ordinances around mask wearing and gathering size. And the city of Oxford has also launched a great video, including Miamians, on their healthy campaign. Engaging all these strategies consistently, we can help reduce the spread of COVID in our community. We are working very hard to flatten the curve and turn over our current and very concerning upward trend. And our greatest concern is the health of our students, faculty, staff, and community members. And we are doing everything we can to ensure that we are all healthy together. And I want to thank you, Governor, for this opportunity to share this update with the great state of Ohio. Thank you.
Well, Dr. Crawford, Fran and I have a grandson who is first year and a granddaughter who's second year. And I'm sure they would want me to ask you the question, what's it looking like for moving in?
So our move-in date is scheduled for September 14th, and then in-classes will start on September 21st. And so we notified the community yesterday. We're going to watch those metrics carefully over the Labor Day weekend, and then we'll actually let everybody know in the Miami community no later than next Wednesday on how we're doing, where we sit, and how we move forward together.
And Governor DeWine with a 6-month update, along with the president of Miami University, talking about how they're trying to keep Ohio's universities open amid this pandemic of COVID-19. I'm Mark Neuse. Thanks so much for joining us. We'll see you again next week.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
Take a pause.
It's long been thought to be the world's rarest dog, the New Guinea singing dog. And it's believed to be extinct in the wild, just a couple of hundred in zoos around the world. But researchers have been able to do a blood test on dogs in the Indonesian wild that seems similar and found that they are very closely related to the New Guinea singing dog. And they share most of the same DNA. And how would you like to have to listen to this all day? The sounds of bottlenose dolphins. Scientists at the UK's University of Plymouth say instead of trying to photograph dolphins in the ocean to count them, they're monitoring the whistles of dolphins. They say counting dolphins by sound is as good as counting them by sight, and they're hoping to refine the technique to help track more elusive sea creatures. Take a pause or a flipper. Jill Nato, Fox News.
I'm Andrew Saul, Commissioner of Social Security. Beware of threatening calls from telephone scammers pretending to be government employees. These calls are not from us. Hang up and report the call at oig.ssa.gov.